There's been a drastic rise in the number of low back surgeries performed over the years. Between 2002 and 2015, the number of elected low back surgeries performed in the US increased 276%. One would think, with such a dramatic increase in the number of surgeries being conducted, that outcomes after low back surgery would be good. But evidence tells a much different story, with low back surgeries having some of the worst outcomes when compared to other orthopedic surgeries. In this video, we will discuss what you should know when it comes to outcomes for low back surgeries. It is estimated that 20 to 40% of low back surgeries are unsuccessful when it comes to making meaningful improvement in patients' pain or function. Repeat low back surgeries have even worse outcomes, with each subsequent surgery having diminishing returns. Only 30% of those who receive a second spinal surgery have a successful outcome. Those who receive a third and fourth spinal surgery experience a 15% and 5% rate of successful outcomes, respectively. So why such low success rates? Well, part of the issue stems from the disagreement among surgeons on how this condition should be managed. To highlight this, let's look at surgical rates across the country. You would expect surgical rates across the country to be relatively constant when adjusting for population size. This is because surgeons are guided by evidence-based surgical criteria to differentiate when an individual is a candidate for surgery and when they are not. But research is showing considerable variation in surgical rates across the country when it comes to low back procedures. Studies attribute this regional variation to a combination of factors, including flaws in the method used to diagnose low back pain, financial incentives and disincentives to surgical intervention, and differences in clinical training and professional opinion in the management of low back pain. Rates specifically for lumbar fusion varied as much as 20-fold and were found to be highest in the Midwest and lowest in the Northeast. With all things being equal, simply where an individual lives can place them at a higher risk for receiving low back surgery. Let's now take a closer look at how low back pain has been commonly diagnosed. The most common diagnostic framework utilized by physicians is the pathoanatomic model. This framework attempts to identify a specific tissue in the body as the source of the patient's pain or dysfunction. For low back pain, physicians commonly utilize imaging techniques such as MRI or X-ray in an attempt to identify the source of pain. But the diagnostic capabilities of these imaging techniques have been found to be extremely limited. It has been estimated that a specific pathoanatomic cause of low back pain can only be confidently identified in just 5% of cases. This means that in 95% of cases of low back pain, symptoms cannot be attributed to a specific structural cause identified with imaging techniques. There is a strong body of research that shows that structural changes such as arthritis and degenerative or bulging discs are quite common, especially in those over the age of 60 years old, and can be present in individuals without any reports of low back pain. There are also studies showing individuals with low back pain without any evidence of spinal degeneration or injury. But nonetheless, diagnostic labels such as arthritis and disc herniation are still being utilized to guide surgical decision-making, and surgeries are being performed to correct these often normal, age-related changes that cannot be confidently attributed to the patient's pain. Now you may be wondering, if there is no clear cause of low back pain, then why does it still hurt? Well, more and more research is showing that low back pain is multifactorial in nature, especially in cases of chronic low back pain, which is considered pain lasting greater than 3 months. Low back pain is very often attributed to a combination of physical, psychological, and social influences, most of which cannot be seen with imaging techniques. From a physical perspective, pain in the lower back can be caused by muscle or joint restrictions, weakness, prolonged or improper postures, and faulty movement patterns. It can occur as a result of a traumatic injury, such as when lifting or from a fall, but can also develop over time as a result of low-load, long-duration strain, such as with prolonged sitting or repetitive activity. But none of these physical factors have been shown to have a stronger correlation to persistent low back pain than mental health. Poor mental health has been shown to be the strongest predictor of the development of chronic low back pain and disability, and has been shown to lead to higher rates of negative outcomes after surgery, regardless of the type of procedure performed. Common characteristics that lead to poor outcomes include a history of depression or anxiety, poor coping skills, highly pessimistic beliefs, and pain catastrophizing tendencies. Research has also shown that claiming workers' compensation, having a history of smoking, and individuals who are overweight are also more likely to experience poor outcomes after spinal surgery. Now, there are certain situations where spinal surgery is indicated. Diagnoses such as spinal cord or nerve compression, spinal fracture, and infections may require surgical management to correct and can result in meaningful improvements in patient outcomes. But in the absence of a clear pathoanatomic cause of the patient's low back pain, low back surgery should be avoided at all costs. Instead, it is recommended that individuals with low back pain undergo a comprehensive conservative treatment program, including physical therapy. Remember, there are very few instances in which low back surgery is an emergency or a necessity, and just because an image shows findings of degeneration does not mean that this is the cause of the pain symptoms. In the event a surgical consultation is required, the patient should receive a thorough mental health assessment to identify potential psychological and social factors that may increase their risk of poor surgical outcomes and prolonged disability. Thanks for joining me on another episode of PhysioShow. Make sure you like and subscribe to our channel to receive more physical therapy related content.